to listen to our sharing session. Can I just share the screen first? Okay. Let's see. Can everybody see the screen?
Yes, we can. Yeah,
great.
it's clear.
Yes. All right. Okay, so first of all, before I forget, thank you CICP for having me here, and also the team for this research. I think this is a very good opportunity for us to share our initial findings of the research. The title of my presentation itself is The Social Perception of the COVID-19 Pandemic. As you can see here, Continuities and Change. So my presentation will basically focus on the continuities of how people perceive the pandemic between the initial phase of the pandemic and recent development of how they see the pandemic. Apart from continuities, we also see that there has been changes in how the pandemic is viewed. So that would be the lens that I will be using in trying to make sense of our data. Okay. But before I go into my presentation, I would like to give a brief introduction to the research itself. The overall title for the research is The Social Perception of COVID-19, Risk and Diffusion. It's an international collaboration with 12 universities in 11 different countries. Luca, who will be the third presenter for this session, for this sharing session, is our main collaborator. He has put in a lot of effort to involve us in his network, and also we have another collaborator, Pina, who is also very supportive in international collaboration with us. Now, the CICP UGM team has done a survey and analysis of the Indonesia case. At this moment, each country is still doing its separate analysis of the data. So we haven't come to a point where we can share a more global result of the research. I hope we can do that in the near future. And I would also like to introduce you to the CICP UGM team for this research. There's myself, Wenti Marina Minza, of course. I'm coordinator of this team, and then we have Pak Fatur Rohman, Mas Aang or Wahyu Jati Anggoro, and we have three wonderful and committed assistants who have put in so much effort in this research: Suraswati Muhyiddin, Aska, and Melanie. They are all, three of them are master students at our faculty. So thank you. Okay, so let's see what is happening in Indonesia. Just a very brief caption of the COVID pandemic in Indonesia. As everyone here probably knows, there has been a rise in COVID-19 cases in Indonesia. And I don't know if, and I think that there has been no signs of a significant decrease yet of the cases. That is a bit in contradictory to what Mas Buldan had just said, but we'll see in the near future. I think the number itself is still fluctuative. So even if there is a decrease, I'm a bit skeptical that the decrease is quite significant. We will have to see. Another thing that I would like to bring out when we talk about Indonesia and the COVID-19 pandemic is the policy dynamics in response to this pandemic itself, both at the national and local level. And I think there are two major policies that are important and kind of stick to people's minds, and that is the PSBB and the new normal, or adaptation of new habits. I don't know the formal English term for it, but I just translated into adaptation of new habits. So these are two major policies of the government that I think that people remember the most. Okay, so some of you might be wondering, why social perception? Why is it why take a stance from social perception? Well, I think to understand how Indonesians make sense of the pandemic, we first need to map out how they view the pandemic itself. So it's more, for me, it's logic that we start from how the pandemic is viewed first. And that's why social perception is important. Okay, and the concepts that I will be using to try to make sense of the data, there are three of them. First is perceived threat, the second is risk perception, and the last is optimism. I'll just give you a brief recap of the three concepts that I'm using. Okay, so the first is threat. Threat is something external of the individual, and it often results in negative emotions such as fear, worry, and anxiety. And infectious diseases like COVID-19 is often viewed in that light as a threat. And the threat itself in relation to risk perception is related in a way that the individual's perception of how vulnerable he or she is to the threat is known as risk perception. These two concepts are usually used in explaining health behavior. But in terms of explaining optimism, I use it in a more general sense. I look at optimism in this presentation as a general optimism to have a tendency to favorable outcome. So it's a bit different than optimism and pessimism in the risk perception literature. And one of the assumptions is that threat perception and risk perception are associated with optimism. In my presentation, I don't go there, but it's something that I think we should try to think about, the relations between these three concepts. Okay, so now I go to the data collecting process. So we have two sets of data. The first is quantitative data that we collected during the initial phase of the pandemic, and that was between April and May 2020. The survey was in the form of a survey that we conducted via Google form developed by Giustino Fortunato University, Italy. The Indonesian sample that we managed to get was a total of 544 respondents. And here's another, double information, but basically the third point is that the survey itself was translated into Indonesian by the CIC UGM team. And respondents, the characteristics of the respondents were mostly young, between 20 to 40 years old, mostly living in urban areas and highly educated. So most of them had at least undergraduate degrees, so higher education basically. Okay, and then the second set of data is the qualitative data that we collected starting September, and it is still ongoing until now. We managed so far to interview 10 participants, which was selected by purposive sampling. We tried to reach participants that were not in the category of the survey. So we have those who were part of the elderly, those from middle, lower economic groups. Well, the middle economic groups we did have in the survey, and then adolescent or high school students that were not really represented in the survey sample. The method itself, we conducted online interviews. For some, we did offline interviews, especially for the elderly. And we are still continuing to collect the data. So if you look at my presentation, if you listen to my presentation, most of the data that I will be using in terms of the qualitative data is also still very early in its analysis. Okay. So now I go into the data. First of all, we can see here from the data that the COVID-19 pandemic is seen as a threat by looking at the answer to the question of how they see the pandemic. And here, most of the respondents say that they see the COVID-19 pandemic as the beginning of a bigger problem. So already it's seen as something threatening. In general, our sample also sees the pandemic as a threat in relation to how it causes anxiety following the outbreak. And the sources of anxiety mostly is because they are worried that they will become sick or that they will not be able to help family members. So it is less about being in control, which I think was quite interesting to see further why being in control is not very important, or it's still important, but to a lesser extent than being sick or not being able to help family members. And you will also see that there will be some overlaps between the data that I use and the data that Father will use, but we've kind of developed our analysis individually. So this might also be in Father's presentation later on. Okay, so one of the explanations that I am offering, there can be several explanations, but these are some of the explanations that I think could be offered. Low anxiety concerning self-control may be due to the belief in a higher power. So in that sense, there is a belief that by nature, humans are not in control, and that control is in the hands of the higher power. So everything that happens is determined by this higher power. And this can also be seen in the feeling of being closer to God during the pandemic. So giving control to this higher power somehow perhaps lessened anxiety in relation to being in control. Another possible explanation, which is still related to the first explanation, is that many believe that the pandemic is a part of God's plan. And this belief continues until today. This is seen from the quote by Andy. Just as a reminder, the qualitative data was collected recently. So he says, I think that Allah spread this virus as a challenge. Allah wants us to increase our faith and compliance. Allah wants us to intensify our religious practices. So here you can see that spirituality and religion is quite important in the discourse of Indonesians in seeing the pandemic. Another point that I would like to highlight from the data is that the pandemic as a threat is not only seen as individual threat, but also as a form of collective threat. And this is, for example, in the health issues. Here's a quote from Nita. Individual awareness of following health protocols is important, like myself, but not only for myself, but for others. So you can see that Nita is not only concerned about herself in terms of health, but that health is also something that is collective. Others have the right to be healthy. I think that's important and a significant quote from Nita. Okay, apart from health, one of the major issues or problematic sector in relation to the pandemic is the economic sector. Now, in terms of economy, it seems that people tend to see economy as more of a collective threat rather than merely an individual threat. So there's a tendency, of course, it's also an individual threat if it concerns or if you are an individual that is impacted by the pandemic, but in general, it seems like people tend to see the economy as more of a collective threat. And here you can see the data that from our survey that many are worried about the future of both the local economy, national economy, but most importantly also of the global economy. So going on to the practices. So what are the practices in relation to seeing threat? In terms of seeing the pandemic as an individual's threat in health, concerning health, the main protocols that people seem to follow is social distancing and avoiding crowds, while wearing in public was still inconsistent. And I will show later in the qualitative data that wearing masks is still inconsistent until today. And then the protection measures, whether people see the measures should be done individually or collectively, both seem to be important, but collective measures seem to outweigh individual measures in importance. So again, you can see that here seems to be an important aspect of how people respond to the pandemic. In terms of compliance towards regulations, it seems that persuasive and coercive measures are considered important. However, Indonesian people tend to prefer persuasive methods in preventing the spread of the disease instead of by coercive methods. So persuasion seems to be quite important as well. Okay, so I go on to the next concept in trying to understand how people view the pandemic, optimism. Here from the data, it shows that people tend to believe Indonesia will be able to recover in a matter of months rather than years. And I find that as a very optimistic view towards seeing the pandemic. However, even though they see the pandemic as being resolved in a couple of months, which basically is a speedy recovery, they also see that the government was late in taking action. So here's a quote from Naomi. "The problem is that from the beginning, the government has chosen the wrong decision, very late in responding and unclear." So Naomi is very critical of the government's action in response to the pandemic. So then the question is, why is there this optimistic view in seeing the pandemic? And one of the explanations that I can offer is that the data was collected during the beginning of the pandemic, and there is a possibility at that time that people were not yet aware of the seriousness of of the COVID-19. Another thing that another explanation perhaps would be that seeing threat as a collective problem raises optimism, because if it is a collective problem, then there should be a collective effort in overcoming this problem. So people become more optimistic because I don't have to do this alone, basically. All right. Okay, so now I go into the 7 months or 6 months. Some of the data was collected in September. So let's say 6 to 7 months into the pandemic. And here I would like to highlight some of the continuities and the changes in how people view the COVID-19 outbreak. Okay, so until today, the pandemic is still seen as a threat. However, it seems that the intensity of the threat is seen as being decreased. Here's another quote from Andy. He's a very good participant. We use many of his quotes. Since the COVID-19 outbreak, I have felt terrified. So here you can see that he used to see that as a high threat. But after the new normal, I feel that it is something normal. Wearing a mask is enough, and I have started to play ball or takraw. So then you see that from this quote that the virus is normal. It's not something as threatening as I thought before. Emotions such as insecurity, shame, and guilt should be, sorry, it should be this one first. Okay. In general, the perception of threat has lessened, but risk perception remains high. So even though people see the threat as decreasing, they still see that the possibility of contracting the virus is still high. And I think that one of the explanations for this is the contribution of the new normal discourse. If you remember, during the initial introduction of this new normal discourse, people started to see that, well, everything has gone back to normal. And then the government revised the term of new normal to the adaptation discourse. So here's another quote following the other quote from Andy. After the new normal, I am making peace with COVID-19. And I think this is something that the government is also encouraged to see the COVID-19 as something normal and to make peace with it. Even though the new normal seems to have been the trigger to the increase of the COVID cases. So he is also aware that even though we have to make peace, and this is something normal, this virus, we still have a possibility, a high possibility, to contract the disease. Okay. And even though the risk perception is high, people still seem to partially follow health protocols, and they also assume that they feel safe when they are in contact with close friends or relatives. And here's a quote from Dickey. When I am with a friend at my friend's home or hanging out in a cafe, I am ignorant towards health protocols. And I think most of us actually feel that way. With friends, I feel close. We shake hands, high five. We no longer use masks, and we have a relaxed conversation. So I think many of us can actually relate to Dickey's experience, and it's a bit difficult to be disciplined when we are in the circle of people with close relations. However, in some cases, the threat itself is seen as high, but the risk perception is low. So here's a quote from Faisal. He says that all diseases are dangerous. Here you can see that the threat is high, but not all people who contract the virus dies. Don't be scared. I truly believe in God. Nobody determines who lives or dies except God. So even though he feels that the threat is still high, he thinks that don't be scared. He thinks that it's God's will. If he contracts the virus, it's God's will. If not, then well, everything is in God's hands. So trying to make sense of this rationale, I see that it seems that we have some quotes that are similar to Faisal's way of thinking. It seems that people whose opportunity cost to complying to health protocols are high seem to seem to rationalize that the risk perception is low, even though they see the threat as being high. This may also be due to the lowering fatalities or the mortality rates recently in comparison to during the beginning of the pandemic. So even though the positive cases have not really significantly decreased. And again, also the belief that it's God's power that determines our fate. Okay, so here there still a continuity of preference for persuasive forms of policy. And so even though there's a tendency for more coercive measures to be taken by the government, it seems that these coercive policies result still in moderate forms of punishment. Here's an example that I think we are all familiar with. Punishment to do some kind of social work for not wearing a mask in public. So it's not really persuasive, but it's not a very harsh form of punishment. Oh, okay. So wait, I need to go back to the thing on symbol. Okay, so in terms of seeing the pandemic as a threat and risk perception and what measures should be taken, what I find interesting is that emotions such as insecurity, shame, and guilt as perceived symbolic threat might actually be more effective or be effective in parallel to other measures in exerting compliance to health protocols. And what is meant by symbolic threat is threat that is not merely from the pandemic itself, but that has to do something with something that more moral. It has something to do with morality. So here, if I am in an environment where people don't wear masks, I'm confident for not wearing a mask. But if I am in an environment where most people wear masks at the mini market, I feel insecure. I feel a bit ashamed of myself. So here's shame. And then I feel guilty if I don't wear a mask, because wearing a mask is a moral responsibility. So if you're thinking of interventions, I'm a bit optimistic that this might also be something to be thought of using symbolic threat. Okay, let me go back to optimism. Okay, so now we go to optimism. Until now, many are still optimistic of overcoming the pandemic, but no longer believe in a speedy recovery. So here again is a quote, it's too late, or the government took action too late in the beginning. So now the disease has spread, and we should focus now on the prevention of the spread of the disease. So here from the quotes, we can see that Dickey, for example, doesn't believe that we will be able to overcome the pandemic soon. However, this optimistic view that one day we will be able to recover from this pandemic is still intact. Okay, another important point that I would like to bring out is that the awareness on the importance of collective coping and solidarity to recover seems to intensify during the recent months of the pandemic. Here's a quote from Rizki. It is important to be cohesive in facing the virus because, for example, we all need to wear a mask, comply to health protocols, and carry out social distancing. So here, cohesiveness, groupness, collectiveness, that's something that came out. We started collecting money and contributing to 3 to 5 families. Here's a quote from Jaka, and he's one of the elderlies that we interviewed. He has been helping his neighbors by organizing other families who are more capable economically to help families who are affected by the pandemic. Okay, so I've come to the end of my presentation. I would like to just give a brief summary or highlights of some of the points that I wanted to bring out in the presentation. The first is that over time, there are continuities and change in perceiving the COVID-19 pandemic. Seeing the pandemic as a threat continues until today, but the perception on the intensity of threat has changed over time. In general, risk perception towards the possibility of contracting the coronavirus remains high. And the key to the concept of risk perception, I think, is more towards susceptibility or vulnerability rather than the intensity of threat itself. So in many literature on risk perception, I find that there's an assumption that risk perception and threat go in parallel. So if you see the threat as being high, then your risk perception is also high. But what I see from the data here is that what is more important in seeing risk perception is internal, that it's more about, so no matter even if the threat is seen as low or medium or high, if we see that we are vulnerable to that, to the threat, then the risk perception is considered high. Third point is that in cases where following health protocols results in high opportunity cost, risk perception seems to decrease. And various resources are used to justify this lowered risk perception. The fourth point that I would like to bring out is that despite high risk perception, health protocols are still partially followed until today. Informal settings and close personal relations seem to contribute to more relaxation of health protocols. Next is the role of symbolic threat in collectivistic societies. So perhaps well, I put this collectivistic societies in quote because there is a huge debate on what consists of collective, or what collective societies are about. But let's just assume that Indonesia is part of this collectivistic society. Well, the use of symbolic threat might actually be effective in exerting compliance to health protocols and changes to it. Public spaces remain a contested area of health protocol practice, as we see. So what seems to come out in the quotes is that public spaces is an arena that is full of contestation. And while there has been a shift to using more coercive forms of punishment for individual perpetrators, the punishments have been relatively mild. Optimistic views concerning recovery remains, but the recovery itself may take longer than anticipated. Sorry. And the last point that I would like to present is that the perception on the importance of collectivity in overcoming the pandemic has intensified over time. We don't know how far this perception may go, because of course, solidarity and collectivity has its positive and negative sides, but we'll have to see what happens in the future. Okay, so thank you very much for your patience in listening to my presentation. I look forward to a fruitful discussion in the end. Thank you.
All right, thank you, Ibu Wenti. And we will continue listening to the materials by Pak Fatur. If you now have questions to Ibu Wenti, because I see some of you are raising hands, we will talk about it. We will discuss about it in the discussion session, so not now. Maybe you can write down your questions on somewhere else, and then at the discussions, you can post it in the chat room. But then remember, don't put it now in the chat room, because we want to still use it to translate what the speakers are saying. Okay, and now the materials will be delivered by Pak Fatur Rahman. It's about COVID-19 preventions and optimism. To Pak Fatur, please take your turn, sir.
Thank you, Gema. I would like to present my slide. So first, let me share screen. Can it be seen, Gema? Could you give me feedback?
We can see it now, sir.
Okay. Thank you very much. First of all, I would like to thank CICP, Mas Buldan, and friends and colleagues there, and also Professor Luca Tateo, who I think asked Ibu Wenti and friends to collaborate in collecting data, and later will maybe publish together about this topic. So later I joined the group, and I just see ask the data and then analyze it. And for this presentation, I haven't had intensive discussion with Mbak Wenti, but I just give some idea by sending my draft, and then Ibu Wenti has already, I think, give a very good, clear about the issues, and it is connected with my presentation. Surprising me. Thank you, Mbak Wenti. Yeah. So not to repeat what has already been presented by previous speaker, we know that pandemic has caused various problems, not only health, but economic and social economic politics. And I think now we have heard from Biro Pusat Statistik, Indonesian Statistical Bureau, about the growth of Indonesian economic in the second quarter, minus 3%. So with accumulation with the first quarter, about minus 5%, also about 3%. So now we have already had economic growth minus more than 5%. It is a bad news, and I think this problem will fall by other problems. And not to repeat what I've already been presented. So here about the anxiety, loss control, economic, and now we just last October we heard from Indonesian political Lembaga Indikator Politik Indonesia that prevention efforts are ongoing, but there are differences debates in the formulation and implementation of the policies, meaning that the government and the people who control this country, who, for instance, between central government with the provincial government, sometimes debate each other for which policy should be implemented in national level and also in provincial level, especially in PSBB. I forgot about the PSBB. What is this? Pembatasan sosial, whatever, social distancing, use area of social distancing or social contact, social control like that. And if in May, more than 50% people prefer to have PSBB, and last September decreased more than 10%. Previous speaker said that no, they are not so afraid with the threat, but how to cope with the threat. So meaning that PSB is okay, but not so tight, and people should have a social economic activity to continue their lives, because it is impossible if our life depended on support from the government with many bantuan or whatever the name. And what is psychology response, meaning that people and academy or university people and also practitioners in the field. First, with government and NGO, they work together. For instance, Himpunan Psikologi Indonesia, Indonesian Psychological Association, has already worked together with kantor presiden, kantor sekretariat KSP, kantor sekretariat presidential office, on giving support for psychological support for people who are who has problem with related issues on COVID-19, and also some NGO without collaboration with government, including the university like Faculty of Psychology, has already have already had so many programs to help people, mostly by using what we call online, and mostly free, to because as found and described in earlier, that so many anxiety indicators, so we can help them by whatever the name, we consulting with just talking or supporting something to make psychology become important contributor in this situation. But not only action on the field, there are many emerging studies, mostly descriptive, because we don't have any experience how to do the study like pandemic 19 right now, and some also exploratory. Even in international level, I tried to find a good publication in more than exploratory or descriptive studies, but we could not find a lot. Of course, some has already published. For instance, in British Journal of Social Psychology, edition of July, but I think they published not in July, later August or September, and there are many explanation, but still based on theoretical or using some theories to explain why this some psychological issue emerge. As academic people, we expect there are not only description and explanation, but we could make a theoretical formulation, meaning that we do not expect that in the future we would have this tragedy like this, like COVID-19. But based on this experience, I think we need to formulate some explanation more comprehensive by building theory that bases on the data. So, like what this is the issues that how to decrease risk perception, increase risk taking, like what to actually split infectious disease, meaning that people can increase in set group membership, increase trust, reduce disgust, etc., etc. So this is one concept that need to be proven in the field based on the data. But I do not have any information about how this theory become tested. I would like to leave this some finding, but now I move to the question. I think the previous speaker have already told us very clearly about many issues, and I would like to choose only two issues. The first one is because this is the most important thing, we have to prevent the spread of COVID-19 before we got the vaccine or drugs or whatever the name to stop this virus. So the formulation is preventing behavior, including washing hands, social distancing, and wearing masks. We could focus on this behavior, but we need to explain, because in daily life, we always met so many people. On one hand, they are very disciplined, wearing masks, for instance, but on the other hand, some groups do not care with this kind of preventing behavior. So we can formulate the question by asking how it can be explained. That's the first question. The second question, I already mentioned for the issues by the presenter before about the optimism. After getting problem with the threat, and then we try to prevent, how about the future? So the question is, especially the big impact like this, how optimistic is our society? Of course, I don't want to explain in the society level, but society would be represented by individuals, and why. So this is the idea how I formulate the study. The first one, we know about the threat here. No experience before, contagious. There are so many people sick and dead, growing casualties, meaning that cumulatively. And this is the key one, no cure yet. So the external is caring. We call isolasi mandiri, or we also can be cared at the hospital, but you know that the beds in the hospitals are very limited. So besides having caring program, implementing policy like PSBB also implemented in all, sometimes very tight, sometimes become longer in English. I lost my verb. And preventing individually, what I already said about at least the kind of behavior. And how about the future? Are they pessimism or optimism? So my focus is into kind of issue. The first one is the preventing at individual level, and then second, optimism. I don't want to talk about pessimism. Of course, we can use in the opposite saying pessimism, but I prefer to use word optimism. And because this is I'm not sorry, I do not have a proposal to do the new research, but I, as a part of the research team, I use the data set, the same with Mbak Wendy use for the quantitative data with 544 respondents dominated by females, and among them are adult and in a city, university student or university graduates, and also including S1, EA and master. And they perceive themselves living in we call red area, meaning that they are their environment are dangerous. We don't check it based on the maps of COVID-19, what we call Satgas COVID-19, but we just ask them about the perception of where they live. Are they living in the green or the red area? And they know about COVID-free area, we call green, and many COVID, when people with infected by COVID, we call red area. And descriptively, but before I am talking about variables included in my research, based on the available data, I explore the variables, the possible variables based on the items. Of course, there are groups, many groups of items, but so far when we, I think when they ask Luca about what's the name of the variable, because funny or silly, when we collect the data, we didn't think about what kind of variable we would like to use or to be formulated. And so, but of course, like standard item when we ask about disease, something like that. So there are many groups of items, and I try to use to apply exploratory factor analysis, and then after getting groups of items, I try to sorry, give a name, and then of course based on the some theories or concept, psychological concept. So we found 6 variables that are if we use the psychometric analysis, it is accepted that based on factor analysis quite very good. This, for instance, example of the items, the prevention behavior, I keep my distance from other, jaga jarak. I use digital media to connect with relatives, and I will never leave the house without mask. And another example of the commitment, I feel that it is very important to have personal commitment in complying with the rules regarding the prevention of infectious disease by setting an example from yourself. And for the vigilance, kewaspadaan, I think the vigilance is appropriate. Collective coping. Yeah. Later, I would like to define, after having groups of items, I define operationally based on the items. Collective coping, for instance, in this precarious situation, we should have a sense of shared responsibility and be united as a nation. And the optimism, I am optimistic that there will be a solution, and close to God, as already raised by Mbak Wenti, this Tuesday I feel closer to God. So the means of these variables like this converted into the range 1 to 5, yeah, because to compare each other, to categorize, so I use the conversion of the item, the variables from 1 to 5. The prevention means prevention, and about 4.37. I categorize it into high commitment to the very high. This is the highest. So people commitment to prevent to behave healthy, about 4.7, almost 1.7, very high. But the kewaspadaan, vigilance, just middle. Collective coping, close to God, and optimism categorized into high. Now move to study 1. I have 2 studies. The first one is about the prevention behavior. I found the health model of social cognitive theory will be used to introduce or to understand why people try to prevent the disease. And social cognitive approach promotes self-management of health habits that keep people. Of course, this is not really self-management, but after people, other government or the COVID-19 Satgas always persuade people to wear masks and etc. Have to manage themselves. It is quite difficult to control this kind of behavior as health habits. So I use the self-management here as an approach to the prevention. The aim of the health promotion and disease prevention model is first to rewarding them into the healthy life. People now value kinds of behavior to protect themselves, not being infected. And the second is equip people with self-regulatory skills. This is not easy because you know that in the malls, in the banks, people should be controlled by before coming into the malls or into the building. So there are satpam, security, to control our behavior by wearing masks, etc., or washing the hand. And encourage habit change. I think this is not exist yet, but of course, I just take into account from this model. So the key role in the disease presentation is first self-efficacy as focal determinant. I think the description from the previous speaker quite clear that they can control their behavior, and hopefully they can control the spreading of the virus. And not only person, but should be done by collectively, so we call collective efficacy, and hopefully there will be new system of risk reduction. We call it the new normal. In this study, we don't have self-efficacy variable, but by having vigilance and commitment to prevent, we can use these variables as what we call representation of self-efficacy, not really self-efficacy. You can criticize this this approach, but we don't have, because the data is already exists. So I use the data to make closer with existing concept. And collective efficacy, we use collective coping. This is the model. So we hypothesize that prevention behavior could be predicted from commitment, vigilance, and collective coping. Prevention here is an act or a practice to avoid the COVID-19. Prevention of what mainly consists mainly social distancing, wearing masks, and washing hands. But in this study, we don't have item of washing hands, but there is an item about the communication through social media. So I put this item not to replace, but as a representation of how we prevent the spreading of the virus. Independent variable of this model is commitment, is the serious attention to prevent the spread of COVID-19. Vigilance is an attitude of caution, so as not to be exposed to the risk of COVID-19 during pandemic. And the collective coping is an effort of members of a connected network, familiar or social, to manage a distressing event. I use Alliance and Friends definition, and in this case, collective coping is all collective action to prevent the transmission of COVID-19. Before analyzing regression analysis, I correlate each other. Here, prevention is the dependent variable, and commitment, vigilance, and collective coping are independent variable. So correlation between prevention and commitment is very high. It also happened between prevention and collective coping, with vigilance moderate. But we also found that amongst independent variables, there are correlation, and this quite high correlation, commitment and collective action. But later I test the collinearity between commitment and collective coping, and I found it is not necessary to be said as collinearity doesn't exist, because indication collinearity exists under the criteria. The result of the analysis for the first model, prevention can be predicted, of course, by commitment, vigilance, and collective coping with 80 point something. Of course, P significance under 1.01, and the R square is 0.33, meaning that the prevention can be predicted by commitment, vigilance, and collective coping, with the coefficient determinant of independent variable contributing to explain prevention is 33%. And amongst the independent predictors, the strongest predictor is the commitment. So if people have commitment to prevent, they will prevent. They will act preventing. And the collective coping is the second variables, meaning that at individual level, we interpret further about commitment as individual level, collective coping individual, but internalized from the collective awareness, and the vigilance still significant, but the contribution is not as high as commitment and collective coping. That's the first study. Excuse me. The second study is about optimism facing and how to cope with COVID-19. I found also another other optimism definition, and optimism can be seen from two sides. The first one is disposition optimism, meaning that this is like like traits that people always optimist, and meaning that expectation that good things will be plentiful in the future and bad things scrap. So meaning they pessimist, but very little. And the second one is learn optimism from Seligman, it's positive psychology. It's the process of recognizing and challenging truth to thoughts in order to develop more positive behavior. I really difficult from the items existing in the database, which one is what kind of optimism based on the items. But based on the path I used before, I assume that in this case, optimism is mostly learned optimism, not the disposition of optimism, based on the experience they have and also and hope something. Unfortunately, when I tried to find about optimism as to explain optimism, most of the studies list optimism as determinant factors or independent variables, especially in health. So people should optimism to make them healthy. Of course, we know about it, but to stop optimism as dependent variable, I should find another concept. So here, I use optimism as one of the focuses to measure readiness for the future after experiencing a pandemic. We explore the factors that influence optimism in three domains, namely individually, preventing behavior, social, psychological, collective coping. I found only one study so far about the effect of collective coping to optimism and the spiritual close to God. It is quite indigenous, like Indonesia, that close to God would be important for to become optimism. This is the model, the conceptual model that optimism can be predicted by prevention, behavior, collective coping, and feeling. When they use as feeling close to God. Optimism reflects the belief that the outcome of events or experiences will generally be positive. In this study, optimism is a belief followed by action, not only belief, but followed by action to deal with the impact of COVID-19 successfully. So they believe that their action will be successful to stop or to cope with the COVID-19. Independent variable prevention is an act or a practice. We already talked about it. In the first study, prevention is a dependent variable, but now we put as the independent variable or effect of the behavior on their optimism. And collective coping also used in the first study, and close to God is an assessment and action that show a close relationship with God. Intercorrelation optimism as a dependent variable correlated highly with prevention behavior, collective coping, and close to God, all are significant. And amongst independent variable also correlate each other significantly, and this is high correlation, again, prevention and collective coping. But I also test the collinearity, the possible collinearity, and I found it is not necessary to afraid with the collinearity because the indication of statistically the indication of collinearity didn't prove. Now the model is accepted with F 44.9 significant below 0.01, less than 1 per thousand. And the contribution of these three variables to predict optimism is 21.5%, where collective coping is the biggest contributor to optimism with a standardized beta 0.303, followed by close to God and the prevention. So it's interesting, but I don't have enough time to try to explain why the people not really firstly on their behavior, but most important optimism here is explained by collective coping and followed by close to God, meaning that this is like how people become optimists, not become of themselves, but because of like social and then spiritual God, and then the least is the individual act or effort. We can discuss about it, and so far I don't have enough theoretical understanding about this kind of explanation. So I will not repeat about the result by reading the conclusion, but I would like to jump to the further studies based on these two studies. If we combine together about based on two studies, we can have a perspective, not tested yet, theoretical model of how people prevent optimistic when they have when they face with pandemics like now. This is like the independent variable, but in the structural equation modeling, we call it as exogenous variable, collective coping, commitment at individual level, vigilance, and close to God. And the prevention would be mediating variable to become optimistic. So if you are interested in doing this kind of theoretical development, we can work together, try to analyze based on the existing data held by CICP. So it's quite theoretical, not like previous presenter, which who explained descriptively and interestingly on the phenomenon, but I would like to move a bit deeper by using analysis, statistical analysis, and this is the challenge for me and for you, if we can not only doing in the field preventing, but we can also try scientifically develop the theory, and this is the finding and prospective theoretical I already have. Thank you very much.
Okay, thank you, Pak Fatur, for delivering the materials. And now, before we continue to the questions and answer, we would like to greet our guest lecturer today. I think he is with us already in the link, Luca Tateo from the University of Oslo. If you are here already, can you say hello, please, Mr. Luca Tateo?
Hi, good afternoon for you.
Okay.
Good morning for me.
Yes, good morning
Hi,
for you.
Dr. Teguh.
Hi, my
Thank
dear
you for
friend.
joining us.
Thank you very much to all of you for inviting me. I'm really missing you and Jakarta. I'm happy to see you virtually, but I'm really looking forward to see you in person.
You can
Thank
get
you
through
very
the internet. Come to the internet and come over to Indonesia. Can you do that?
I wish so. I wish so.
But we can
Okay.
take coffee together, yeah?
Definitely.
All right. Thank you, Luca. Fortunately, we still can meet on the screen just like right now. And we are wondering too with another guest, even though not a speaker today, Mr. Guisapina Marsico. Are you already in the link with us? As we heard that you will join us today. If you're already here, you can say hello to us. Okay, I don't think so. All right, that's all. That's the end of the presentations. Now we come to the discussion part until 3 p.m. before taking a break. If you have questions already, you can post it in the chat room. And if you want to ask directly, you can use the raise hand facilities. And if you are wondering how to find it, I can guide you a little bit. But after that, if you still can't find it, you can ask the committee for further information. So if you want to raise your hand, you can go to the participants and then find your name there. On the very last row, which is on the bottom, the very bottom, you will see three features: invite, unmute me, and three dots. And then you can click the three dots, and there you will find the raise hand facilitations. And then you can raise hands, you can ask questions after I ask you to unmute, and then you lower it down. It will be a sign for me that you already done with your questions. All right. And please don't forget to address to whom you want to ask the questions. Okay. All right. For Aisha Habibah, you raise your hands. You can ask to the speakers. Please unmute yourself.
Thank you very much for the opportunity. My name is Kuni Aisha Habibah. So today I would like to ask some questions for Bu Enti and also for Pak Fatur. I am interested in the way you use collective coping, collective responsibility, collective threat, etc., to explain your findings. And personally, it reminds me that Indonesia itself is actually a collectivistic society. And what I want to ask is that, do you think that there are actually benefits of being collectivistic society amid the pandemic? Or in other words, does being a collective natured society holds advantages or potentials for Indonesians to overcome pandemic, and have Indonesians understood this potential yet? That's my question, and I hope I don't stray too much from your research and also from your presentation. Thank you.
All right, thank you, Ms. Habibah. And while waiting for other questions, I think we can directly answer the questions. Maybe Bu Wenti or Pak Fatur answering the questions. It's about collectivism. Will it be an advantage for Indonesian people to cope with the pandemic or not? Okay.
I'll go first.
All right, Ibu Wenti, please.
Before I forget the question, okay, so if I can just give a brief recap of your question, it's basically what are the positive and negative aspects of collectivity? Because both, which is also quite surprising, because Pak Fatur and I seem to come to the well, one conclusion that is the same, that collectivity matters in how Indonesians see the pandemic. And what I want to say is that I think that collectivity, to a certain extent, is a potential, that it is a resource that we can use to help the process of overcoming this this crisis or disaster, if you may say so. However, collectivity also has negative features to it, especially if you look into another concept that is related to collectivity, which is solidarity, and you have a more conventional way of looking at solidarity within a collective. And if the solidarity is too high, and there's a tendency to have boundaries of the collectivity even stronger, and it raises the identity of us versus them in a more negative way. So that I think the conventional definition of solidarity, I think, should be something that we should be aware of. But there have been there has been another definition of solidarity recently, seeing solidarity as not necessarily complying to the collective norms or goals, but there is space for individual autonomy. Now, in that sense, I think that collectivity may be more fruitful than the way that we see the conventional solidarity that is usually seen in collectivistic groups or communities. I don't know if I have quite answered your question, but I hope that I've at least touched upon some points that you raised. Yeah? Kuni? Habibah,
Okay.
sorry.
Yeah, thank you so much, ma'am. And if I may repeat what you say, so it's basically, it has the advantages and also the disadvantages. Okay, thank you very much.
Okay, I could give some more points. First of all, the spreading of COVID-19 is amongst people with the droplets, etc. So you know that kind. So this characters of virus is like very close, very amongst people who are collective compared to individualistic, is in the collective community or society like Indonesia, the spread will be very easy compared to individualistic community. So with this kind of situation, we can also use the collectivity to prevent by distancing, but together, not individually. So like pisau bermata dua, ya. So negative point in another one, and also positive point in another one, and on the other hand. So meaning that if we use to prevent, because of the characteristic of spreading pandemic like this is based on what is the relation amongst people, so we can also stop, not stop, but also collectively using our what we call orientation collective as together. So it is impossible right now if you yourself isolated in a home, at a home. So later, cepat atau lambat we call it, will be infected. But if together we do the same things, it will be more easy, or at least lessen the probability of spreading.
Okay. Well, thank you to Pak Fatur. Well, Habibah, do you want to ask 3 questions, or is that enough for you?
I think it's enough for me. Thank you very much.
All right, thank you. And now we'll go to the chat room. We have a questions from IUP students, Sarah. Okay, the question says to Pak Fatur. I was wondering, I was wondering if there was a reason to why collective coping has bigger contributions to optimism than closeness to God. Because from my eyes, religion is such a big thing in Indonesia, and I thought that it would have had a bigger contributions to optimism. How do you think about it, Pak Fatur? Thank you.
Yeah, we can think it's in more wide with wisdom. Sorry, if we just close to God, but together praying together without using masks, for instance, I think this afternoon I just read. Sorry, integration class, please. Okay, if I just read in the newspaper that one of the pondok pesantren now should be locked down, a very famous, popular pondok pesantren in Yogyakarta, because 190 santri and kiai now infected by virus. This is the case. I don't want to blame. It is not a good or bad example, but we can explain this kind of situation by if they use very tightly the health protocol, I think they can prevent better together, because in the past, I mean, before getting infected, yeah, and now they have to be spared each other, not isolated, I mean each other, to prevent more casualties. So like this, meaning that, of course, I myself should close. This is time for me to be closer to God. People frightened by, I think, death or something like that, or infected at least. But it is not enough. We need more, like what we call more operational, more real, by collecting, collectively we apply sorry, a protocol like that. Don't don't think about that. Oh, people are not so religious like this. No. This is in terms of practicality. We don't think only religious and religiosity, something like that. Thank you.
Okay, thank you, Pak Fatur. It's such a good explanation, though. Okay, well, I want to ask to Sarah again. Do you have any questions to that, or you want to respond? You can speak directly, though. You can unmute yourself if you want to. But if not, you can give me a sign through the chat room. All right. I'm waiting for you. If you want to ask directly, you can raise your hands. As I see on the screen, so I don't see anybody raising his or her hand yet. Okay, so from Sarah, the answer is enough. All right, thank you, Sarah. All right, so is there any of you that wants to ask Pak Fatur or maybe Bu Wente about the materials today? You can raise your hands. Sorry.
Is there anyone? Otherwise, I would ask.
Okay, maybe we need to wait for a little while, Bu Bo.
Okay.
Okay, so we have a question from Murdoningsi. She wants to ask to Pak Fatur again. It is about, yes, it is about social factor or external factors that would be considered in the phenomena of collectivism and coping the health problems, such as the pandemic of it. So he sees that the explanations has a lot of concerns in internal factors such as the individuals. It looks like it looks similar to the research, to his research though, to her research, I mean, about the strengths, the psychological strengths of individuals in coping with the coronavirus. And these individuals find that hope, including optimism and positive thinking and also efficacious, help with that coping strategies. And then the question is, what are the social factors or external factors that need to be considered? Maybe about the beliefs or maybe unbeliefs about the leaders. Okay, so she's asking about your opinions, Pak Fatur. Thank you.
Okay, thank you. Yes, in what we call internalizing or accepting the policy or program implementation, I think very important to follow or to have your own formulation of the action to prevent the spreading of COVID-19. Meaning that if you believe that the program is good and you trust to leader, yes, of course, it will be it will influence the effectiveness of COVID, the prevention. I think I have already shown the model that how trust affect the future prevention or spreading of the virus. On the other hand, also we in the model, I think. Let me show you about the model. So accelerated spread of infectious disease depend on increased trust to leaders. On the other hand, reduce disgust. You know that we in Indonesia sometimes look at the television that there are so many politicians who act disgusting. Acting something that we don't like. So reducing disgust. I mean that people can be more wisely behaviorally and improve their trusted behavior or something like that. So there will decrease risk perception, meaning that they will prefer to accept the program, not to refuse. But so many, if the program, the government officer acts, we call Nora or something like that, that you use of discuss. So we don't care with the program. If we don't care with the program, the virus will spread, meaning that more cases of infected virus we can find because not of the personal behavior, but because of the leader who behave unwisely and be like blaming and don't care. This is your problem. This is your business, not my business, or something like that. But in general, you of course you can make better study or more comprehensive study by putting some social economic variables. That's good. I have a problem because I should use, I have already certain variables. You know that it is like analyzing secondary data, not designing from the beginning. Ya. Saya hanya menumpang dari penelitian ini. Mas Buldan, Bu Wenti mungkin kemarin juga not enough time to prepare the studies because we have to react fast because of this COVID-19, something like that. That's meaning that this is the limitation of my studies. We don't have enough social economic background to be analyzed together with some psychological variables. Thank you.
Okay, thank you, Pak Fatu. Bu Wenty, do you want to add something about it? Maybe you have something in your minds and you want to share it with us?
Yeah, it just reminded me this question that there are some information in the survey about sources of information that people use to gain more knowledge of the COVID-19, and it seems that government sources or official sources are still important. However, the degree of believability, or I don't know what to use, what the term is, but the degree of believability. So they don't necessarily have high belief in what they are getting to. So again, I think that the point I think that Pak Fatur was also explaining is that it's important to have the trust towards the government if any program for the COVID pandemic will be successful. And I think that's one of our homework in Indonesia. One of the I think one of the challenges is that because of the dynamic and the fluctuation of the condition of this outbreak, is that governments also need to adjust their policies, and this adjustment is sometimes quite confusing for people, and somehow it seems to have reduced their trust, as if the government is not the gas, like the government is not strict to a particular plan. So it's like going back and forth. So I think, yeah, just reminded me of that set of data. So we can look back into that. Okay, I think that's it for me.
All right, thank you, Bu Wenty. That's to gain the trust of the society. All right. During Bu Wenty's sessions, we saw a friend, Irfan Haryadi, raising his hand. I would like to address you. Irfan Haryadi, do you want to ask the questions directly right now? Are you still on the link with us? Irfan Haryadi. All right, if not, I will go to the chat room. There is a chat from M.A. Hakim. Okay, this is to Mbak Wenty. He said that he really enjoyed the presentation. Thank you. I'm interested in your finding on the role of social norms to nudge people to follow the COVID health protocols, which is quite consistent with the previous large-scale studies, such as by Sibley et al. In 2020. On the other hand, however, I'm a bit worried about its potential backlash, which is encouraging people to socially punish people who defy the norms, like the stigma and etc. I'm interested in your way taking the issue. Okay. So, Bu Wenty, do you have any opinions or anything to say about it?
Yeah, thank you, Hakim, for the question. And also, I think this question raises an important point of, not seeing something in a naive way, including seeing social norms as the one and only solution, because to overcoming the pandemic in terms of getting people to follow the health protocols. And I think it's an important point, and I agree, Ms. Hakim, that one of the consequences of putting that into place is that we might not be aware that it may also raise stigma. So on that part, I agree. And some of the data that we've collected, the qualitative data especially, seems to go into that direction, that people who, for example, do not wear masks are stigmatized as being irresponsible, as being stupid, as being, morally unfit. So yes, there is that possibility, and I think one of the things that we need to think about is how far, if it is beneficial to use this kind of symbolic threat or social norms to get people to follow health protocols, to what extent and in what way can we use it? So so I'm raising actually another question. Perhaps some of you here have ideas or probably suggestions, or maybe from reading, or I'm open to that. But yeah, I think that's a valid point that you raised, Mas Hakim. Thanks.
Okay, thank you, Bu Wenti. That will be good for further research, however. All right. And is there any of you who wants to ask directly? You can raise your hand. But if not, we can go to Bu Partarini if you want to ask something.
No, it's answered already.
It is answered already.
Yep.
Can I just add something?
Okay, Pak Buldan.
Yeah, maybe this goes to the point of from Mas Hakim's question. First of all, hello, Mas Hakim. Good to see you. So just kind of like to add on that, I think one of the global issues that's occurring right now is there's this meme called COVIDiot, like hashtag COVIDiot. And I think that's like an explicit way how people are kind of punishing people who are not complying. And I think one of the recent cases in the UK was there was a people who made a trip to Greece, and then I forgot, was it to Greece or was it from Greece? And I think the people in the plane, they got contracted with the virus, and then people were kind of like, punishing these people, or like, telling these people that they were COVID idiots, so they're not compliant. And it's become a meme or like a hashtag popular since May. And at that time, interestingly, Indonesia, they had the hashtag Indonesia Terserah, which is also we're analyzing in ICP, and Indonesia Terserah is also a protest from the medical experts who are protesting the government's inconsistent policies, and they express it through this Indonesia whatever. Okay, do whatever you want because we don't care anymore. You're not following the government's compliance. So I think we're seeing this on a global scale by people using COVIDiot, and in Indonesia we see the Indonesia Terserah. What I would say is that Steve Reicher from University of St. Andrews, he wrote about this in The Guardian, and he mentioned that one of the backlashes that may come from this, people shaming other people for non-compliance and having this socialized in the media, it may create a norm as though everybody is not following the rules. While in actuality, most of the people, the data, like in the UK, he mentioned like the data in the UK, most people are compliant with safety protocols. But because the news is saying that everybody is not complying, people might think it's normative. And because people are thinking it's not, people thinking it's normative not to comply, this might motivate them to start breaking the rules or like not complying with the safety protocols. So yeah, it's probably just like my 2 cents on that. Thank you, Kima.
All right, that's great, Pak Haider. Okay, that's the answer to Mr. Hakim. Do you want to add something, Pak Hakim, or asking questions about it? No? Okay, I don't think so. And if any of you still wants to ask directly, please raise your hands, or you can post the questions in the chat room. We still have time, like 13 minutes before we have a break at 3 p.m. Okay, is there any questions still?
We can stop earlier.
Yeah.
I'll be very happy. Not to wait.
Yeah, I was going to say the same thing. And well, I'd just like to add a couple of things. I think the way forward to our study about the COVID-19 is to kind of integrate the different sets of data. I have qualitative, we have the survey data. So again, if any of you are interested, students, to be part of this project, you're most welcome. It's still ongoing, but yeah, and also the conclusion that we come up with, we still need to integrate that with the data that Mas Aang is analyzing. So we have 3 different sets of analysis that we have developed individually, but we have to come to a point where we try to integrate our analysis. And I think that would be an interesting step to take. Yeah, just something to add. Thanks.
And grab it, students, grab it for your thesis. So it's time to make your thesis done within a very short time. They have a lot of enriched data on it. Be smart. Aku ngompori students.
But that's good, Ibu. That's great. Okay. Well, if you don't have any questions though, just like Pak Fatul said, we can take a break earlier, but then just this opportunity doesn't come many times. So we are hoping you to use this like to ask the questions or whatever it is. Maybe you can give your opinions or giving your thoughts or whatever.
Maybe just a little bit comment on Mbak Wenti's study.
Okay.
As you may already know that most studies on the psychology of COVID at the moment are mostly dominated by, large-scale quantitative research, which are useful but also boring on the other hand. So when I see your qualitative study, it's quite interesting, and I believe it can offer so many new insights. On the other hand, however, from your presentation, at least it seems like there's some aspect of the data that I think can be elaborated further. For example, the role of religion, particularly, can be something quite, unique in the Indonesian context. However, of course, some people in the United States, and this is particularly important given what's happening in the United States, where people tend to stigmatize the religious approach on the COVID responses. And for example, people see that some data already show that people who are from the evangelical community, they are more likely to, defy the norms, and even they tend to believe in conspiracy theory around the COVID-19. But I don't think this negative approach on the role of religion is applied or, relevant with the Indonesian context. If we observe some, like the programs and the action that some Muslim or religious-based organizations have done in Indonesia, they tend to be, more positive toward the the preventions of the spread of the COVID-19. So again, I think your qualitative data, especially on the role of religious belief and religious organization in handling the pandemic, can be something very important theoretically and practically. Thank you.
Yeah, thank you for the comment, Ms. Hakim. I agree with you. I think there are two points, and I think that was also in Pak Fatur's presentation. I think there are two areas to explore that we can explore in the qualitative study. The first is the role of religion, as you mentioned, but the other one is issues that have to do with this idea of collectivity. So those are, I think, two issues that we need to explore further. And as I mentioned in my presentation earlier, that the qualitative data has just been collected in September. So I think that's a good suggestion to direct where we can go further. Yeah, thanks.
Nice, thank you.
Thank you, Mr. Hakim, for giving us the thoughts and also the new information. And we have another questions here. Okay, this is from Niken Rasati. She wants to ask about the correlations between optimism and preventive behavior. Okay, she said that I recount how government has done a lot of campaigns on optimism using the new normal tagline and how this might mislead people to have a biased optimism based on asymmetric informations. I just want to ask, is there any data showing the level of knowledge or informations that the respondent has on current state of the pandemic so that we can know whether their optimism is based on sufficient information and differentiate the relationship between optimism and preventive behavior amongst those who are biased, people who see this in bias. Okay, that's the questions. We can return it to Pak Fatur or maybe Bu Wendy.
I could answer a little bit.
Yes.
To some extent, I think the optimism, of course, if it is learned optimism, that should be based on the data. This is the information, accurate information. The problem is we don't have really what kind of test, how to test this is really learn optimism or the opposite one is not the learn. But to some extent, if you are very optimistic without any or with not based on the data, it's okay also. It's okay, meaning that it is still necessary for us to have optimistic views compared to the pessimistic, because I think many theoretical explanation that having optimistic or having positive attitude will be better to face this kind of pandemic.
All right. Maybe Bu Wendy wants to add something?
No.
Okay, no. So is that clear for you? Sorry. Miss Niken Rarasati? Okay. All right, that's all. Thank you to Pak Fatur. Okay, that's it. Well, if you still have questions, maybe we can give to only one person for the last questions, but then if not, we can take a break right now. We'll wait like for 5 seconds, maybe. You can still raise your hands to ask for the last question. I'm sorry, I heard something. Okay, I think that's all for these sessions. We will have a break. We will come back to the link again at 3:15. We have done the first sessions together with Pak Fatur and also Bu Wendy. A very short conclusions that I can draw throughout these first sessions is something like this. The concept used to understand people's perceptions towards the pandemic are perceived three risk perceptions and optimism. And through the current research, we can see that Indonesian people generally perceive this as a threat, driven by the high rates of anxiety. The importance of collectivity actually helps the people to overcome this issue, and it has intensified over time. This also leads to a high level of optimism, and the pandemic will be resolved. The preventive behavior, in fact, should be improved as the awareness of the spread of the virus is not that high. This behavior is influenced by the commitments, collective coping, and the vigilance. And the collective can be used to overcome the issue for Indonesians, particularly supported by the solidarity. It might be fruitful though, and there might be a lot of research that we can do regarding the other external or social factors leading to the way of Indonesian people, especially to cope with the pandemic or the spread of the virus. That's all the conclusions for this first session. Thank you. You may have a time for break. We will see you again at 3:15. You don't have to leave this link, however. you still can stay with us. Or if you have to leave the link here, make sure that you don't come late. Our second sessions will be delivered by Professor Luca Tatia, PhD from the University of Oslo. That's for the session. Thank you. Assalamualaikum warahmatullahi wabarakatuh.